The Virtual Pediatric Nursing Trainer is a 3D simulation that affords upper-level undergraduate nursing students the opportunity for virtual, hands-on practice of nursing concepts. In its initial phase, the simulation incorporates video game design elements to allow nursing students the opportunity to practice applying nursing knowledge to a clinical setting. This simulation is focused on recognizing signs and symptoms of respiratory distress. Future phases of the simulation can be adapted for other pediatric medical conditions. Socioeconomic and cultural characteristics of the virtual patients will be implemented in future editions of the game. The Virtual Pediatric Nursing Trainer was developed using the Unreal Engine and utilizes high-fidelity audio in tandem with 3D modeling and animation techniques to generate realistic virtual patient scenarios. Nursing students are presented with virtual pediatric patients who have one of 4 conditions: asthma, bronchiolitis, pneumonia, and cystic fibrosis. In round 1 of the game, a virtual instructor, the charge nurse, accompanies students to the patient's rooms and explains the indicators and symptoms of asthma and bronchiolitis. She then instructs on which actions should be taken. In round 2, nursing students must determine the proper treatments for 2 new virtual patients, one with pneumonia and the other with cystic fibrosis. At any point in the game, students may ask the charge nurse questions by utilizing the drop-down menu. The questions and corresponding answers are designed to provide students with additional background information about respiratory disease conditions. If a student performs an incorrect action, the charge nurse will intervene. A student's performance is measured by the success indicator on the game's interface. This determines the number of correct and incorrect actions taken. Ongoing feedback appears on the indicator in a range from green to yellow to red. Green means a student is performing well, whereas red indicates that a student may need assistance. Before students begin the simulation, they may choose to play 3 mini-games, which are designed to reinforce key patient assessment practices that will help them perform well in the main instructional game. These mini-games help students identify general signs and symptoms of respiratory distress. In the first mini-game, students are presented with an overhead view of a patient's chest. Students must then identify the location of retractions. In the second minigame, students observe a virtual infant coughing. The student is asked to categorize the cough by type and determine the respiratory condition that could produce such a cough. And the third minigame presents students with a respiratory condition, and they must determine if the cause is viral, bacterial, fungal, or from aspiration. Throughout the entire simulation, students may access a journal in the form of a text editor to record notes about their patient symptoms and actions taken. Information that students collect is available to them throughout the game. At the conclusion, the charge nurse sends students to meet with a second nurse who will be taking over their shift. The student hands off the patients by answering multiple choice questions. After that, students can quit the simulation and receive a detailed assessment of their performance. Virtual Pediatric Nursing Trainer, Respiratory Distress, is a joint venture between the School of Nursing at the University of Texas at Arlington and the Arts and Technology program at the University of Texas at Dallas.